growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, you're tuned in to another episode of The Lionhearted with Dr. Steve Rasner. Tonight's episode is going to be called Secrets Behind the Curtains, meaning how do you make all this work and endure for year after year with a track record of success? I mean, how do you juggle all the plates to run a successful independent fee-for-service dental practice? How do you take all the courses? How do you deal with all the patient fluctuations, the ups and the downs? Look, I don't have all the answers, but I've had a pretty solid track record for 39 years. And I thought about it. I thought, you guys need to hear, how do you put it all together? And, maybe where do you start and all that kind of information. So let's get into it. If I look a little beat up, I got to tell you something. I am having a horrific week. See there? I want you to know. A practice that does well over $4 million a year and has done so for probably the last 15 years. I have bad weeks too. This week stinks. I wanted to say something else. It's terrible. No new patients. I'm right before Thanksgiving, by the way. The team is just on vacation. I think they went on vacation last week. It is just infuriating. I have to tell you, it is. My work is good. I feel that's the only good part I can cling to this week. Had a couple new patients and just demoralizing, and I'll get into why. I'll tell you right now, if you're listening on the way to work, see, I'm telling you this on purpose because I don't want you guys to think. I just did a panel show in Las Vegas where I was up on stage with 6 other very successful dentists, and we took questions from the audience. And after the third question, my answer, which had nothing to do with the question, this is what I said, and I want you to hear it right now. I really do think this is one of the keys to long-term success for you. I mean it. I said, listen, I know this isn't answering your question. They stood up on a microphone out of a big audience and had the courage to ask these questions. And they were all very good questions. But I said, look, I know this crowd is sitting here probably in awe of the biographies of the people on stage with me right now. But I want you to know, and I didn't know these guys, by the way. I knew of one of them. I said, we have really bad weeks too, where nothing goes right, where somebody is mad at you, a patient. I mean, to me, that's one of the biggest disappointments I can incur for myself. Employees move, their husbands and wives get transferred to other states and things, and people quit that you didn't expect to quit. A case doesn't go quite like you want it to. And I'm going to talk about that too, about long-term endurance during this podcast. I need to hear me on this because you making it over a long period of time has a lot to do with you avoiding burnout. Anyway, I was on stage and I said, we have bad weeks. I don't know these guys, but I know that I have a lot of bad weeks. And because you have a bad week, and sometimes a bad week can linger for a few weeks, a slump, I would call it, into 2 or 3 weeks, then you have to take action. That's been my policy. Then you have to have an emergency meeting and allow everybody to know in detail exactly what is going wrong. But the point of me telling you this right now is because you had a bad November or whatever month this year does not disqualify that you could have an amazing year when it's all done. I mean, here's the takeaway with this. I never allow myself to get too high or too low. And I didn't invent that virtue, but it's true. I don't. I could have a killer record-setting month, which I have had this year. Where we averaged over $100,000 collections, well over that for a given month. And, don't start giving bonuses out, and don't start taking everybody out to lavish dinners. You could bonus. You can appreciate your staff verbally. You can buy lunches, but don't start giving out raises that you're locked into, or you could very well regret it. But take the takeaway from this first point. And by the way, you can reach me, and I wish you would reach me, reach out to me at Dr. Rasner, DrRasner at AOL.com. I know, it's ridiculous. I'm the only person on earth that still does that. My administrator, is trying to break me of it, but right now that's where you have to reach me. And you can check my courses out, which I'm very proud of, at RasnerInstitute.com. Or my last name, institute.com. I wanted to get that into the broadcast, of course. So the first idea is don't get too high and don't get too low. If it lasts more than 2 weeks, start documenting early on what it is that's disappointing you. So if I disappoint a patient, I didn't finish that thought. That is something I have a very hard time with, and I will do anything to make that right. That is just how I'm built. So understand, in the course of this year, expect the good with the bad. It's going to happen. It's just impossible. Quit idolizing these so-called famous dentists on social media. I'm sick of it, quite honestly. This is not the point of this podcast tonight, but social media and showing off your work is really wearing on me. It used to be more academic and informative, and from my point of view, 3 to 4 years ago plus. It seems now that what's going on is like somebody has their case of their life, and they post it as if every case they do is like that. And even when they post a gorgeous case, they get incredible criticism from a lot of people. I would not spend a lot of time in social media, Facebook, etc., trying to expand my clinical talents from that point of view. Again, a small but little tidbit there for you. Also, we're talking about you having long-term success and keeping your head together, because that's a big part of it, man. I would tell you to minimize the bad will. Here's the thing. The people that like you, or the people you just knock it out of the park, that get you. Don't you love that? Don't you love those people that just they don't say it enough? The patients that'll come to you and say, well, I've never been to a place like this before. You guys really go all out. God, I love when I hear that. I just don't hear it enough. And that's my point. People that have bad will towards you, and we're just, most of us in the service industry, and we are in the service industry, we're servicing healthcare, we want to please. And when we don't fulfill that, it can be heartbreaking. So where you can, and I'm going to tell you exactly where, I would encourage you to minimize the bad will. So don't charge for broken appointments. Mistake, absolute mistake. A broken appointment is, there are 2 reasons for it. One is, if you're getting a lot of them, please go back and see if a payment was due as to the day that the appointment was broken. And if you want to fix that, in 2020, have a meeting dedicated. This is how you get things done. Have a meeting dedicated towards getting paid up front. Define what that means. If I was in charge of your meeting, what does getting paid up front mean? It means when you have the treatment plan, which is often in my case on day 1, That's the day we're presenting finances. That's the day we're getting paid. Why? Because I'm greedy and I want to, fatten up my bank account? Nope. It gets the money thing out of the way, which is always ugly or uglier when it lingers. So some of you have spent time in my office and would know that it's not about slick talking. It's the opposite of that. It's not about tricking people. It's about being really patent and upfront about, look, you just made a great presentation, I hope. And when I say you made a great presentation, I mean from the moment that patient first called your office, whoever you have in charge of taking that call, taking them through the whole process, which you've heard me speak to you about tirelessly, into how that whole thing should look and feel step by step. And if you're not sure, go back to my earlier podcast. Or maybe I'll do a fresh one on it. If anybody wants me to do that, through an email, you let me know. And you have presented very clearly what the patient should do, from your opinion, and why. And now you're presenting, of course you're presenting the financial aspect of it. How can we fit this into their life financially? I mean, no wonder this is so hard. Did you ever stop and think about something? Number one, we have a profession that a lot of people fear. Number two, they can put off the treatment of the pathology they have very often for years for two factors. One, it often doesn't hurt. Gum disease usually doesn't hurt. Even periapical pathology can stay dormant for years. You know this is true. And number two, don't you find it fascinating how people can hide the most atrocious, unesthetic smile behind their lips because they learn how to, they learn how to move their muscles of their mouth around, and they know exactly where to stop the smile or when to exercise certain facial tricks they do so nobody sees the problem. That's why it's so hard. And then you take this person into your office and follow the Rasner rules, for example, which have worked incredibly well for me most of the time, right? And in a span of an hour or maybe 2 hours total, in many cases, you're asking this patient to make a significant investment. And in my case, and I know a lot of you reflect my philosophy, I don't even want it to be a lot of money because I don't want it to be, right? I had a patient in today, true story. This is typical of what happens to me. And remember, I started this podcast by telling you I'm having a rough week. Guy comes in, he's 60 some years old. His chief complaint was a broken tooth on the upper left. Nice fella, had his own business. That's a factor with my patients. If I say, so, where are you from? He tells me where he's from. Well, what do you do? What kind of work you do? I've been on disability for 16 years. And they have a mouth that you can already tell has significant issues, or they've told you that. That's generally not a good sign. So this gentleman had 6 through 11 left. His anterior teeth were left. He had a couple molars. I'm talking just about the maxilla right now. And everything was pretty much shot. Okay? It was a terminal dentition on the maxilla from my perspective. And I didn't want it to be that. In fact, I want you to know this. I hope this fits into the podcast. So as soon as I see that developing, I looked at his x-rays. I did a cursory exam on him to get a feel. I knew this could go that way. And, so I look at the 6 anterior teeth. The 2 molars were shot on his upper left. And the teeth that were left had about 25% bone loss, but they had caries. The guy was a big smoker. This was a problem case. I didn't want him to even want to have I was hoping he was ready to say goodbye to his teeth. And when I started giving him options, I gave him an option of a denture. And I say stuff like this. I said, listen, don't kill the messenger. But my job right now is to educate you, inform you. And I want to tell you guys something. At this point in the conversation, which I would say is about 15 minutes, I've done a lot of things that I'm pretty good at in bonding to this guy and making this person trust me. And maybe that would be a subject for another podcast. Like, what are the subtleties that allow a patient to gain trust in you? Because you have to have that. And let me just tell you briefly, it's just being earnest and honest when you're looking at a patient. And I would hope that the majority of the people that tune into these podcasts know that that's what I would reflect. You know, there's courses out there for you guys on how to talk patients into treatment. I mean, they're literally almost called exactly that title. How to get better at closing. I think I've even written articles called The Art of the Close. When I say art of the close, to me, that means a communication process between me and the patient that enables me to get enough information that I can really give this patient true options and clarity about what's going to happen with those options. That's why I have 3D models in the room. So when I know it's a terminal dentition and we're possibly going to talk about a denture, I reach over to a model, literally on a hinge articulator, take the denture off, and I say to the patient, so listen, this is a denture, a real denture, not just a model of someone that never received this denture. Nobody ever asked me why. Even I don't remember. But I have this beautiful, well-groomed model. I don't even remember how I got it, but I recommend you get one, by the way, of an upper and lower denture. And I take the denture off and I put it in his hand. I said, I want you to see what a denture's like. You know, you probably have seen people maybe in your life that had a denture, but it's in your hand right now. And let me talk about the good and the bad. And I talk about the good. I said, look, the good is, compared to the other options, it's cost effective. You don't have to go through multiple surgeries that you might need if we go into the implant direction, which I'll talk about next. And, you know, I don't know what is your experience. My experience is most of the time, if they've never worn a partial or any type of removable prostheses, which this patient hadn't done, then way more often than not, I hear, well, I'm not really into taking my teeth in and out. And I'm fine with that, except the next problem with that is the conversation about implants takes significantly longer. And I know the fee, and I tell them that, you know, that the fee is significantly more and that there are a range of complications. And you guys got to know, one of the big, and this wasn't really the direction of my podcast originally, but I feel like this is very important information for you. So I want you to keep tuned into this. And maybe we'll just have one on the terminal dentition soon, although I think I've done one podcast like that. But this is critical stuff that I'm talking to you about, because as soon as I know I'm discussing an implant retained case, we all know, and he has teeth left, the patient has teeth, you know, we're talking way north of $20,000. I don't know how anybody on the planet could do it for less with quality. You know, provisional, if he has enough bone, which he probably doesn't in the maxilla. This particular patient was a smoker. I asked him, how much do you smoke each day? He said, enough. I said, look, I'm not judging you. I just need to know, a couple cigarettes a day is different than a pack a day. Which one are you? And he said, I'm a pack a day, which probably means he's 2 packs a day. You know, that's a problem if you're going to be bone grafting. That's a problem as a catalyst for peri-implantitis. Then I go to diabetes. I asked him about diabetes, and you know, he was a controlled diabetic from his diet. And I go right into, I got to tell you something more than I ever did. I don't know if I did this 20 years ago when I was so excited. I'm being honest about getting implant cases. I know, and I don't think we knew as much about the risk factors of implant cases back then. Anyway, long story short, I go into this because you have to. I mean, I don't think you have the latitude if a patient says, well, talk to me about implants. I don't think you have the latitude of saying, I think you have to be very, very thorough from the risk factors to the cost. Of course, I'm not telling them exact numbers. What I told this patient, it's absolutely north of $20,000. And I'm usually, Michelle hates, my new patient coordinator, when I quote fees because I'm usually way off. And I was way off with this guy, about $9,000 off. So, of course, he went home to think about it and talk to his wife, who he didn't bring, which you hear me tell you all the time. One of the key factors in you getting yes, meaning you get paid at that first visit, is having a significant other hear what you have to say. Well, I could talk about case presentation forever, but that wasn't supposed to be the crux of this podcast. So let me back up for a minute to where I was. I told you the reason I like to get paid up front is because it minimizes broken appointments. It's absolutely the truth. So that should be something you look forward to in 2020. It's really, in my opinion, a mindset as to why you don't get it. Like, in your mind, you find that uncomfortable. But I'm going to tell you something. I've done it for many, many years. And think about it for a minute. If you know that you're going to treat that patient with exactly the same professionalism, dignity, ethics that you would a patient that's paying you over time, by the way, why wouldn't you do that? And you offer a product that you really believe is superior to just about anywhere they could go to get that same product, whether it is a denture or whether it's an implant retained prostheses, then why would you be shy about getting your money up front? I don't think you should be. Now, when you do that, let me tell you another caveat. You are going to get patients that are going to get buyer's remorse. They are going to sit with you for an hour plus, buy into everything you said, make you feel that you have totally connected, and then they are going to go home, and in some cases, less than, I would say, 3%, they will cancel when they think about the money that they have to invest. Happened to me this Monday. That's why I don't even like it. I don't want it to be a big case at this point in my career. So you got to let them out. That's my takeaway. Don't start nickeling and diming this patient because it leads to something called bad will. So example, you took models on them. I wouldn't charge them for the models. I would charge them for exactly what the minimal charges you think you have to cover. A new patient exam, the x-rays he took in the office, anything along those lines. But I would hesitate to nickel and dime them and put another patient in your community that's going to badmouth you. You know why we got to talk like this? Because if you want to have a insurance-driven practice and do 1 crown per year and 2 restorations and let the majority of your patients' mouths slowly deteriorate because you're insurance-driven, then no, you don't have to listen to anything I'm telling you. When you walk the road less traveled, forgive me for stealing that for this show, when you do comprehensive examinations, when you educate patients, as L.D. Pankey said, is the make of a great dentist, a master dentist, then it is the road less traveled. And people, for the first time, because the majority of the profession doesn't do this. I know this for a fact. I mean, you know this for a fact. And so it makes you often sound aggressive, and that's really something that we have to focus on. Like, what are the have-tos? I often come down to that. With the patient I was just alluding to earlier in this podcast, there is no in-between. You got 6 teeth left on the maxilla. What are you going to do with that? There's nothing in my conscience that I could think of. 25% bone loss, no posterior teeth, some mobility, horrible hygiene, caries as an issue. There's nothing to do. There's no in between. That same patient with a healthy periodontium, which is hard to imagine, no, maybe they don't have to do tooth replacement right away. Maybe the goal is to maintain what they have. It's as unaesthetic as it is. You have to do what I brought up in earlier podcast, and that's called draw a line in the sand on what you allow a patient not to treat. That's a big issue that you have to think about. Okay? And my line is, I won't allow them not to treat their perio. I had a patient, a good example, that came in last week. He's going to lose 2 central incisors. Now, they don't hurt, but they got 85% bone loss. And if you ever have a patient like this, they're going to lose actually all 4 lower central incisors, naturally with some type of tooth replacement. She had to think about it. In the interim, since last week, one of the crowns in the posterior part of her mouth, which had endo and some decay, has popped out. And she's okay with treating that, getting rid of the decay and making a new crown on that tooth that had root canal. It's not symptomatic, but it has caries. So now that it came out, the patient's okay with treating that. I have a problem with that. She has active, advanced pathology, asymptomatic albeit, in the anterior portion of her mouth, but wants me to ignore that. So you got to draw the line in the sand on what you're going to overlook and not overlook. I really think I do. What are you going to do if your patient needs a couple crowns and they really need scaling and root planing? They're not 50% bone loss. They may be 20% bone loss. And there's some sub-G calc. Not loaded, but sub-G calc that you see. And it needs, legitimately, absolutely needs, in any good office, scaling and root planing. But they don't want you to do that. They want you to do the cleaning the best you can and treat the one crown or something specific. That's a line in the sand for me. That's how I feel. I don't know how you could feel any way different. A couple of things, because this is going longer than I intended it to. To minimize the bad will, I just want to finish that. Don't charge for broken appointments. Allow them to change their mind. You might be so psyched. You might go home on a Thursday knowing you got a $25,000 case that made you a great week, and they call next week and you had the models poured up and you did all that. I wouldn't punish the patient. I would leave it in goodwill. I'm not kidding. Third rule. I used to do this for years. I still do it. I called it the $200 rule. And that means anybody at my front desk can adjust a bill up to $200, which means off, on a balanced dispute. And if it's a quality patient and you think it's for the good of the practice. Now, I'm not giving random $200 off to patients, but the moment that you say to a patient, a good quality patient, I'm talking somebody that doesn't miss hygiene appointments. Maybe it's a family of 2 now. It used to be a family of 4 or 6 because they had kids that came to you. Or they switch insurances or something. They're asking you for a financial break. We have a rule that allows people that have worked for us, who know our systems, to give them that discount or to make an adjustment on their bill without having to check with me for the good of the practice. And I think it's important when you teach that to your front desk. Because here's the thing. If you tell that patient, well, let me check with my manager, and the manager has to check with the doctor, by the time, they're almost embarrassed by the time you give whatever you're going to give if you were away. So I call it a bend, don't break rule. And I'm going to leave you with 2 more points. These might sound controversial to keeping it together and not losing your mind in this perfection-oriented industry that you and I have chosen. I find myself many times trying to get this perfect number, let's say 6 in place, and sending it back to my lab because the facial anatomy is a little bit off, and the light's not hitting the crown in the right direction, and the transition line angles and all that stuff, or the shade's a little off, don't misquote me. But before you drive yourself completely cray-cray, look around their mouth. The patient I'm thinking of had number 5 look ridiculous. Okay? I mean, it was not my crown, which I'm sure I probably have a crown somewhere that looks ridiculous. But the metal collar was showing. We're talking about probably a 10-year-old crown right next to it that the patient didn't want to treat. And they have different shades on the opposing side. Before you drive yourself nuts, which I often do, and I know many of you do, just take a deep breath, look at this mouth. I would always tell you to strive for work that you can be proud of, that if another dentist saw it, you would never be embarrassed. Marginal fit, reasonable aesthetics. But sometimes we spend our careers trying for perfection on a patient that will never allow you to get perfection because they won't restore their whole mouth or a section of their mouth to allow you to achieve that. And, having that mindset. I'll give you one more. Not having to complete a schedule as it is scheduled. I used to drive myself absolutely bonkers thinking I had to complete the schedule that was on my schedule. A lot of times I will do a quadrant of work or spend 2 hours on a patient, and enough's enough, even though I plan to do more. Unless they were going on vacation or that kind of a thing. If it's a patient that's set up into sequences and it just sometimes can go another day. We're human, man. You got to remember, you are doing an amazing service. If you're following my protocol, it means you're taking a lot of CE. If you're following my protocol, it means you're not ripping people off. If you follow my protocol, you put a lot of energy and work into this. And sometimes you got to give yourself a little break. I know this was all over the map tonight. It's not what I intended. But that can happen sometimes. So I hope you found some of these pearls useful. And thanks for tuning in another week to The Lionhearted. See you next week. Till then, have a great one.